Action Healthcare Conference. I'm Casey Cadesia, Member Experience Advisor at the Schwartz Center for Compassionate Healthcare. We are so excited that you've joined today. Please join me in welcoming Jessica Chen Fang, Associate Director of Physician Vitality and Associate Professor of Medical Education at Loma Linda University School of Medicine, Barbara Cowden Hernandez, Director of Physician Vitality and Professor of Medical Education at Loma Linda University School of Medicine, and Kathy McMillan, Director of Employee Spiritual Care at Loma Linda University Medical Center. Jessica, Barbara, and Kathy, we are so happy to have you with us today, and now I'll turn it over to Barbara.
Thank you so much, and thank you for the opportunity to talk a little bit about some of the programming that we have here at Loma Linda University and Health Center. We really consider this a privilege, and we're happy to talk a little bit about who we are and what we do. We share this hoping that possibly you will find some things that will be useful for you as well in your work. So thank you for joining us. I want to start by saying a little bit about Loma Linda University Health so that you understand the context of where we're working. We are a faith-based institution that was established in 1905, and the medical school was established in 1909. This is a health sciences institution, so all of the degrees are pertaining to health sciences. We have over 4,000, about 4,400 not medical students, but students across the campus. We are a magnet site for nursing and also have achieved a Medicus Integra Award for physician well-being from the Coalition for Physician Well-being. So we do see a lot of patients that before I go on, I want to say something about this Good Samaritan statue. This is actually right in the center of our campus. We have the School of Dentistry to the left, there's a church to the right, the medical center and the School of Medicine is straight on. And in the center of our campus, we have this Good Samaritan statue, which of course, those of you who know the story will understand that this is about someone who had compassion on someone who was of a different race, of a different creed. And we think that this really embodies what we're here to do, is to serve all people, regardless of the cost to ourselves, and to be compassionate in our care to others. So just something about where we are, and you can see that we're here sitting in the valley between Palm Springs and Los Angeles. We are kind of right at the edge of the desert. We include 8 distinct schools on our campus. We have 6 different hospitals, you can see. We do have a huge trainee population of 780 residents. We do have 840 medical students as well. So this is a pretty big enterprise to try to teach all of these individuals, not to mention the PT, nursing, X-ray, etc., all the other students that we have come through often. We also have a higher percentage of underserved patients than most places. We sit right between Riverside County and San Bernardino County, which are 2 of the largest counties geographically in the country. And so we do have a very large catchment area. As a result, we are probably in the top 20% of racial diversity for both our faculty, our practitioners, and our students on our campus. So we really do try to work very closely and include as many people who are racially underrepresented, ethnically underrepresented in our campus, and to make sure that we are trying to serve everyone in an equitable and very compassionate way. We have a poll that we'd like to start out with before we get into the meat of our programs. So if we could have that poll pop up, we'll ask you to respond to 3 questions. So please move your cursor, make sure you scroll down on this, and take the poll if you would. So we'd love to see you. Are you all seeing that? I'm seeing that. So I think there might be a little bit of a delay, but there are 3 questions here. How well do you think your institution is supporting the wellness of your employees? The next question, how well do you think your institution does supporting the wellness of physicians? And the last one, tell us a little bit about your personal wellness. We'd like to know about that. And this, I think, frames why we're talking about wellness and why we're trying to do these things with our employees and for our doctors and nurses and staff. Because we understand that if we are not well ourselves, we certainly will struggle promoting wellness in those whom we serve. And wellness has a very strong compassion component that we have to be able to extend something that we have already. For those who are not seeing the whole poll, if you'll scroll down, there's a little scroll bar on the right side of the poll, and you can get down to all the other two questions. So we'll give you just another moment to take that. So we are going to today share a little bit about what we've learned through trial and error. We will talk a little bit about how we have come to develop our programs and how they're received, and we hope that that will be useful for you. We still have people unable to see the poll.
Can anyone, Casey or someone from the Schwartz?
Hi, I'm looking at it. It looks like about half of folks are able to see the poll, and I'm waiting to see if there's an update from our technical folks about what's going on. But it looks like about half of everybody is able to see the poll.
Okay. So maybe in the interest of time, we should move on. So we'll be glad to do that. You can see that, let's see, shall we see some results here from this? So how well do you think that you're doing? You can see that we have quite a spread here of people who think you're doing pretty well, very well, and not well at all, of course. And what about for the physicians? You see some good support. There's a pretty strong bell curve there. What about yourself? Looks like many on this call are doing fairly well. So we're glad to see that. So I'm going to turn this over to Kathy McMillan, and we'll hear from you, Kathy.
Thank you so much, Barbara. So we have a variety of employee resources. I'm going to mention the first ones just briefly, as I'm sure that many hospitals have these things available to their employees. In addition to our chaplain services department, we have a strong employee assistance program that offers support groups and individual counseling for employees. We also have a very strong employee wellness program that offers weight loss, goal setting, smoking cessation, diabetes management programs, and offers very regular webinars on a variety of wellness topics. You can go a couple slides, Barbara. Then the Department of Employee Spiritual Care is a unique department that began at Loma Linda in the late 1970s. It was begun by a nurse, and it served in the nursing division until the early 2000s, when the department was asked to expand to serve all of the employees on campus. So the first goal of our department is to nurture the spiritual health of our employees. And that's not simply religious faith. We are a faith-based institution, but we have many, many employees here from different world religions, as well as a number of employees who don't claim any religious faith at all. So we're looking at a broader spiritual needs assessment of our employees, thinking about meaning and purpose, love and belonging, what gives them hope. And so all of those things are pulled into the role of my department. Secondly, our goal is to teach them how to provide whole person care. Now, we think about whole person care, not just for patients, but for each other, because our culture here is one that is deeply compassionate for each other. My job is full of variety. In fact, I like to tell people it's the very best job on campus, but I have a feeling Jessica and Barbara will argue with me. I'm going to share just a few of the programs that I get to be involved in. A big part of my role is caring for employees. And so I go out rounding with care carts, especially on the COVID units right now. Those carts have just little like $1 items like snacks, like Kind bars and little nut packs, as well as hair ties and nail files and body lotion and things like that. I also run debriefings on units after there have been difficult events, and run support groups for new employees. And I also help to organize our Code Lavender program here when there's an employee who's dealing with a very difficult situation in their life. Barbara, that you heard from already, was very instrumental in starting the Schwartz rounds at Loma Linda. I now coordinate our team, and Barbara and Jessica are both part of that committee. We work with various physician groups each month, taking one of their grand rounds. And I'm sure that others of you have found that Schwartz rounds has been an important part of dealing with our emotions through this COVID process. We've had over 200 that have attended one of our Schwartz rounds, and we're well over 100 on most of them via Zoom. Another part of my role is coordinating our nursing bereavement programs. And as part of that, we have implemented several things that are helping our employees to deal with that part of their job. We implemented the pause at the bedside after a patient dies. This is not a program that's unique to us. Many of you are probably familiar with it. But when a patient dies, it provides an opportunity for a moment of silence to honor the life of that patient. If the family's present, they get to be part of it. It also gives the medical team a chance to just take a breath and reflect and prepare for moving on to the next patient. We've also started honor walks for patients who are donating organs at the end of their life. And we also have a No One Dies Alone program for patients who have no friends or family at the end of their life. Unfortunately, as you can imagine, that program is on hold right now. I've had the opportunity to be involved in a number of research projects. We've had a massage therapy program out of my department for employees, and we did some research on that. We've also done some research on prayer, and we're working on a project on employee resilience. My office works with the Chaplain Services Department on some special programming for holidays such as Christmas, Easter, the National Day of Prayer. And we try to provide both online resources as well as in-person events. Twice a week, I send out a spirit lifter via email. And the spirit lifters include an inspirational quote of some kind. Usually, not this one, but almost always, it includes a photograph that's taken by one of our employees, and then often a verse from scripture. And of all the things I do, that's probably the thing that I get the most comments back from people. Annually, we provide a day of renewal for our employees. This is done off campus and at some beautiful location. We call it Oasis. And we choose a theme, such as, finding fresh perspectives, or unhurried living, or the power of one. And it's an opportunity for employees to gather outside of a work setting and sometimes participate in a creative process such as painting or poetry, and to be inspired. As we all know, when you get people working together, there are sometimes interpersonal challenges. And this past winter, we were hearing about an unusually high number of complaints between physician groups and nursing staff. And so our CNO pulled together a working group that included Barbara and I, and we started addressing clinical relationships. Barbara conducted 6 focus groups, one with attending physicians, one with chief residents, one with residents, and then 3 with other clinical staff. And reported back on that work, and we've developed a plan to address some of these issues, including education about texting etiquette, paging etiquette, working to strengthen the physician and nurse leader dyads, trying to make sure we have strong leadership in each group, and as well as doing education for other clinical staff. About 8 years ago, Loma Linda finalized a whole person care model. We call it the CLEAR whole person care model. CLEAR stands for connect, listen, explore, acknowledge, and respond. And I have the privilege of teaching this model to all of our employees. It started out as a patient care model, and as we started teaching it and using it, we realized that it's really a very, very good model of communicating with everybody. And so, we all show up to work on days when we're not at our best. And so we want someone else to be available and knowledgeable in how to provide care for us at those times. Across our organization, we have about 250 employees who have been selected by leadership as values ambassadors in our Values in Practice program. They're the champions of our institutional values, and they're quite literally an extension of me throughout the organization, because my department has just me and my secretary. So they're the eyes and ears, and they're looking for situations where employees are going through difficult times, where there have been workplace circumstances that may be causing difficulty, such as a large number of deaths in an area over a short period of time. And these individuals work with their department heads to implement activities and programs in their area to promote teamwork and to share compassion with their colleagues. We have a 4-hour training program twice a year where we bring in new values ambassadors. We also meet quarterly for a luncheon. When it's not COVID, we feed people, we gather together. During this time, we have been meeting virtually, but we have a very short part of that program that is education, but most of our time together is spent in what I call cross-pollination. It's an opportunity for our values ambassadors to share what they're doing in their departments with people from across campus. And these are truly the most engaged and creative people you can possibly imagine. I never have considered myself a very creative person. I'm one of those people that can get things done. So if somebody gives me an idea, I can make it happen. But these are amazing employees. And so what happens is somebody will come up with an idea, they can share it with the rest of the group, and then they'll adapt it and apply it to their work area. I mean, we have values ambassadors in our groundskeeping department, as well as, nursing and various departments across campus. So I'll just give you a couple ideas of things that they came up with. Our NICU several years ago came up with what they called the Core Value Award. And they got a couple of really tiny charms that were like an apple core, and they would let someone attach it to their badge, and then whoever received that award for living our values, the next month could pass that award on to someone else at the next staff meeting. And it gave an opportunity for recognition. We had another department it was our advanced practice nursing department, where they're out working in various areas of the hospital all day, so they very rarely see each other. But they decided they wanted to work on teamwork, and so they came up with Chocolate Mondays. And so they would have different people would sign up to bring something chocolate on Mondays, and they would gather for just a few minutes before they would head out. Some departments have done really creative things with bulletin boards for recognition, as well as helping people to get acquainted with new employees coming in. Other departments have done wellness challenges where they'll give little gift cards to whoever gets the most steps in the month. I put out a newsletter 6 times a year where we also share ideas and talk about our values in that, and we give the values ambassadors ideas of things that they can use and share with their departments. So these people are all there to help support our culture and help to, improve morale in their work area. Lastly, I've had the opportunity to be involved in helping with our built environment to help visually support our culture here at Loma Linda. One of the projects that I've had the opportunity to be involved with is the I Am Hallway, which is a series of portraits that are on one of our major hallways. And they're photographs of patients and employees. And each employee usually has one word. This one happens to have several, but something like I am a miracle, or I am strong, or I am hopeful. And then we have a little story. This is just the very beginning of these twins' story. We're also in the last final months of building a brand new hospital that was mandated by California earthquake codes. And so I've been able to be involved in decisions that will impact what goes on the walls of that hospital and how we share our culture with those who come in. So those are just a few of the things that I have had the opportunity to be involved with, and I'm going to turn it over to Jessica.
Great. Thanks so much, Kathy. Well, it's an honor to be here with you all this morning, afternoon, whatever time it is for you. And I'll just start talking about what our office does, the Office of Physician Vitality, where Barbara and myself work. And there's a lot of interfacing between our office and Kathy's office. And it's certainly just hearing Kathy recap all these things again reminds me that because of the work that she does, it gives our office ability to do what we do and trust that the campus environment, the climate is really being cared for, and employees are seen and valued. And so our office focuses on our physicians. And so this is med students, residents, and attending physicians as well. And so the few things I'll talk about here are, 2 years ago, we started doing a more formalized medical student wellness screening. And we're really grateful to partner with USC's Keck School of Medicine. And at the first year, it was the 2 of us. And this is a very comprehensive mental health screening tool that addresses things like risk for depression, anxiety, OCD, panic disorder, history of trauma, as well as things like maladaptive perfectionism, cognitive distortions, imposter syndrome, all kinds of things that essentially we want to teach and equip the med students to better understand themselves. And so they have also a place to reach out. So every year we administer it in the fall, and the end of the screening, there's a page that talks about, what are you at risk for? Please reach out for support. It also assesses for suicidal ideation, and we understand in the medical student population, there is an increased risk compared to the general population. And so the students, between Barbara and myself, we get a lot of referrals. Students will reach out and talk to us. And so what we try to do is make sure the students, all of our physicians know how accessible we are. We are technically available to them 24/7. I think maybe we'll talk a bit later about all the various resources we refer people to, but we are kind of like that first line of care, crisis support in case anyone needs anything at any time of day. So it's a very easy process to schedule time to meet with us. What I want to mention about the screening that's exciting is that we now have 4 medical schools across the United States that are participating, and a 5th one is joining this next year. And we've already been conducting really exciting research. This summer, we were studying the variables of gender and ethnicity and how it correlates to maladaptive perfectionism, imposter syndrome, and suicidal ideation. And we found some really interesting connections. And so there will continue to be a lot of studies in the future, but we're excited about this. Another huge thing that our office does is offer education. And this is, between Barbara and myself, we teach maybe courses in the medical school. We offer a lot of guest lectures in things like whole physician, what is that class that Henry teaches? Wholeness for Physicians, I think that's the name. We'll give guest lectures there. And we also give grand rounds across all the various residencies on our campus. So here are just a couple topics. Like Barbara talks a lot about assertiveness and communication styles, issues of gender bias, resilience practices. We also address topics like diversity, equity, and inclusion. This year with all that's been going on, we talk a lot about unconscious biases, understanding cultural humility, developing this as a person. Other topics include like, burnout prevention, sleep deprivation, how to address that, dealing with perfectionism, with self-compassion. And so between the two of us, we get a chance to share and speak to our residents, our med students, and then faculty development experiences as well. And then lastly, I wanted to share about something fun that Barbara started years ago, which is our physician gallery. And there's probably a photo here. Yeah, so here are some images of the gallery. Right here, that top left photo, that is our employee entrance to the hospital. And Barbara has told me this years ago, it used to be quite empty, and everyone's walking in and out of here. It's a very busy hallway. And she came up with this idea of, why don't we highlight our physicians' photography, because a lot of them are amazing photographers. And so you'll see here, these are 2 of the photos here. What we do is we highlight certain physicians, and I don't know if it's here, but there's a medical staff lounge where we'll highlight one physician's artwork and then describe it. And so here's an example where we introduce who the physicians are, where the photos are from. One of the fun things that happened a few years ago is that Barbara invited the physicians to participate in an exhibit at a local art association. And then the proceeds that they were able to get from it, they purchased rocking chairs for the peds waiting room. And so that was a delight to our physicians. But, as you can see, like if you have your artwork highlighted and you get to see it, your photography, it's nice for your colleagues to know, this is where you went for your summer vacation, or these are, the very gifted photographers that are within our physician population. So that's a fun thing that we do. I think there's maybe been, maybe a third one so far, 3 rounds of that. And we actually are in the process of changing it out, but that hallway right now is where we assess for COVID. So we're not able to change out the photos this season. But it's just a fun thing that our office gets to do annually. Yeah, and I think, let's see, let me turn it over to Barbara.
Thank you. You know, I'm hearing all these things and I'm thinking, well, no wonder we're tired today. We are actually kept pretty busy, and I would echo what Kathy said, is that I think we actually have the most fun job. It never seems to be the same on any given day, and that is really wonderful. I would also like to say before we move on is that we are all well supported by the institution. We tie in really well with the mission of the institution to make whole people, to follow along in the healing and teaching ministry of Jesus Christ, which is our vision statement. And so whatever we can do to be a compassionate presence, this is what the institution is committed to doing. So we're really grateful for the good support that we have and the understanding of the value of what we're doing. This is particularly true right now during COVID, when there's such a strong mental health component to everyone's questions and suffering about that. I wanted to say something about the way we integrate with our departments. And when I say departments, I'm talking now about physician departments. So we're talking about physician staff and ancillary staff within those departments. We do a number of team building visits with departments. For example, some of the high stress, particularly high stress departments like palliative care or forensic pediatrics. I think we have one of the highest rates of child abuse processing here in this area. Like I said, we have these huge counties that we sit in the middle of, and many of these areas are quite rural. A lot of underserved individuals. Not that abuse is limited to underserved individuals. We find that in isolation, some of these problems become worse, and these are very rural areas, some of them. So we really try hard to support our teams. We give workshops pretty consistently. Those might be on brain health, like the couple slides back, you could see Jessica lecturing to our NICU fellows, their fellowship group, about what to do when you feel traumatized around taking care of peri-viable infants. We offer support groups. We run support groups for a couple departments. Like Kathy, we also do debriefings. When we had the San Bernardino terrorist shooting, I was called in. Jessica wasn't working with us yet at that time, but I was called in to do debriefings, several debriefings with the emergency room staff. We were a very frightened institution at that time. And then we had the San Bernardino school shooting. And so anytime these things come up, plus all the wildfires, so we're available for doing debriefs for residents, for our attendings, for our whole staffs. And then of course, when we have the non-accidental trauma, pediatric traumas come in, we also are part of those debriefs. We give retreats. Jessica and I give workshops during those. They might be with different, a whole bunch of different things. I know in another week or two, I'll be giving one in pediatrics. It'll all be up in the mountains. It'll be based around Shinrin-yoku, which is going out and bathing in the trees. That is the translation, the rough translation of that. But we'll talk about, meditating under trees and mindfulness, and that's what we'll give this workshop on. We do program director meetings so that every year there is a summit up in another set of mountains near us. As you saw in the picture, we're right between a mountain range, and so we go up there and we'll be talking about various things like diversity and inclusion. We'll be talking about gender support, etc. And then also some of the coordinators have done some trainings about how to really support your residents in a very compassionate way. How do you detect if they're suicidal? Let's try to get to them before that. We also have a Chief Wellness Resident Program, which was set up in the last year and a half. And we're really happy to tell you that we have a couple residents in each program, and a couple of them we have 4 or 5 wellness residents. And they are the individuals who will set up programs to minimize isolation, also to build morale. So ice cream feeds, bringing in lunch, and then having wellness programming. So for example, in our pediatric department, which is about 100 residents strong, we had, maybe it's 120 now, but we had our wellness chief residents set up a daily program over the noon hour where they would serve lunch out of a fund that they had, and then they would wear a certain color and a certain Disney character on their, either on their badge or on their collar. So it kind of kept morale going, and it was just a time to get together. We found that when residents are able to do this and also to refer people to us who are struggling, that they're able to engage better with patients. Because there's nothing worse in my mind than having a staff that is run ragged, working hard, working for the wellness of everyone else, but really not taking good care of themselves. So we try to promote that through our Chief Wellness Resident Program. Our residents, many of our resident programs have resident resilience days. In our internal medicine program, which is 100 residents strong, they get half a day every 6 months to try to get appointments for their teeth cleaning and their vision appointments and their primary care appointments. As part of that, we have a physician, a resident concierge service, so that they can call the concierge service, get seen within 48 hours. And we find that they or their significant others having sick children, this is incredibly helpful to reduce their stress so that they can focus better on their training and being able to connect well with patients. Jessica and I have started doing wellness checks for our residents. And of course, we have way too many to accommodate between the two of us. And not everyone wants these, but we have a couple, we have 5 residencies and 2 fellowships who have signed up their residents for us to see them every 6 months. And these are really kind of wellness coaching visits. So I tell them from the outset, the only thing we will tell your program is if you don't show up for your scheduled appointment. And of course, now everything is virtual, so it's quite easy. And so it's confidential, and they can talk about anything that stresses them on their residency or outside of their professional lives. We're both marriage and family therapists at the doctoral level. We're well able to field any kind of therapeutic issues they have, and also to refer them to more long-term care. But to date, we've done about 260 visits, and overwhelmingly, we have positive responses from that. They'll say, oh, this is kind of cool, or oh, that was fun answering those questions, or oh, I never stopped to think what's my early warning sign that I'm not doing well. And so we try to be preemptive in helping people feel better, have the awareness that someone has their back, and we think that that makes a significant difference in how they're then able to deal with others. You know, as a trainer of therapists for many years, there was this principle called parallel process. And it goes like this. How the supervisor interacts with their intern is probably how the intern will interact with their clients. And we still believe that now, that how we interact with our faculty and with our residents is most likely how they will then learn how to ask questions and interact with their patients. And so we're really happy that we have this opportunity to serve in this way. One of the initiatives that we set up actually quite a few years ago, I was supervising a marriage and family therapy doctoral student in our simulation lab here. And we put together this process where we could teach the residents how to break bad news, but not using an evaluative checklist like you did this, you did this, you did this, but to get very immediate, meaningful commentary from a group of people who had been trained to know about dynamics. So I brought in a bunch of doctoral level interns in marriage and family therapy. And I'll walk you through this process of how this would work. First of all, this is all simulation. This is a simulation we did with our emergency department some time ago. And they come in with Recessa Annie, and has just flown in from a bomb blast in San Bernardino. And you see the staff working. And then we see the resident who is breaking bad news to a mother and a brother. And let me just tell you, these folks should get an award for their play acting. We were all in tears as we were watching them. Here we are, here we are in the room behind a one-way mirror, watching them, taking notes. And the notes that we would take would be questions. I wonder what the mother was thinking when the doctor held her hand. I wonder what happened when the man in the gray scrub said such and such. This person seemed very quiet. I'm wondering if it was helpful to do such and such. So we were really raising multiple perspectives. This was for a way to just jog people a little bit so that they could learn how to be compassionate. The next step was we would have a discussion on one side of the mirror while those learners were listening in and observing. That's called a protected listening space, where they could just soak in what we were suggesting and talking about amongst ourselves of what we had seen. And then they could take that. In the next step, we would say, did you hear anything that was of interest to you? And yes, they did. And this resident was saying, well, this is the first time I ever had to do this, and I couldn't do this every single day. And so we talked about managing compassion fatigue and what it was like to be working with a team, breaking bad news in this way. At the end, we have a summative evaluation. What did you learn, and what would you take away from this that will inform compassionate care as you move forward? And without fail, people have really appreciated this opportunity. We've seen some people who have been pretty rough around the edges go back to their jobs with great compassion, with a greater understanding of how to interact in a way that a family member would really appreciate, knowing that they are, when someone dies, that you as a provider are always part of that last story of that person. So this is one practice we've done with OB, internal medicine. We've done a number of these with our NICU team, our fellows having to have conversations around peri-viability. So these are the programs that we have developed. These are some of many. We have had a lot of trips and stumbles. We've had a lot of starts and stops. We have really, really enjoyed the opportunity to be able to roll these things out. And in my role, and Jessica's especially, you know, there's this whole hidden curriculum that if you're a physician or if you're a medical student trying to learn how to be a physician, you'd better not let anyone know that things get to you. You'd better not be shedding tears at the bedside, otherwise it'll be a shark feed, we hear from other hospitals, other training programs. And we're really trying to change culture here, that we are all humans trying to take care of one another in the best way we can, and bringing whatever is spiritual to us to bear on the spirituality of patients and families, so that they realize they got something more than excellence in medical care, that they got a whole person experience from us. Just in closing, this is a graphic that Jessica developed for us to use, and we're rolling out this in a modified manner to all of the residents. When they come in, we want them to have something at a glance. We ask, how is your wellness? Because any challenge in any one of these areas can really impact how well we're doing and how well we're able to offer care. Jessica, do you want to say a couple words about this?
Sure.
Model?
And actually, I think it's helpful to know these are based on SAMHSA, the Substance Abuse and Mental Health Services Administration. They put out these 8 indicators of wellness. And if you do a search, many institutions use these same 8 variables, but it's a really comprehensive model for looking at from our physical well-being all the way to our spiritual, including environmental and financial as well. So we have the scale where 1 would be, not doing so well, 10 is doing, the best that you feel, you're doing really well. So it's a quick visual indicator where people can just put a little X or whatever they want to draw on this form. And we wanted to invite you to maybe take a minute and reflect on your own life. And we're going to do this ourselves right now too, but how would we rate our physical well-being, emotional and mental, our social and relationship health, intellectual? And I like this one because it talks about creativity, expanding our knowledge and skills. I think many of us forget to nurture that part of ourselves, our occupational well-being, financial, environmental, and spiritual. Like for example, in this pandemic season, I realized, wow, environmental well-being for me is really huge. I need to work in a non-cluttered space for me to feel sanity. So yeah, well, how about we'll do like a minute and give people time to just mentally assess.
And just to respond to what people are asking, we'll make sure that this PDF is available for you as well. We also want to say that these are actually the domains that we look at when we do our wellness checks for our residents. And so some of the questions we ask are things like, how did you bail out earlier when you were in medical school when things got difficult for you? What strategies did you use? Who are you connected to? When you have problems, who do you go talk to? Under intellectual, we're talking about creativity. What do you do outside of your clinical work that actually rejuvenates you and gives you some joy? Some time ago, there was a seminar, conference, a whole conference in Boston about finding your joy in medicine. And sometimes you have to find your joy outside of your clinical work in order to connect it to what you do in your work. And so we ask about that. We ask about student loans and have you a good way to pay back your loans? Do you have a congregation of some sort? Do you have any kind of meditation, mindfulness behaviors that will calm you or that will frame the meaning that you bring to your work? So these are all things, and really grateful that Jessica put this together for us. So we are glad to have shared this with you. We're open for some questions, and we'd be happy to respond to any of them if you would like to jot down some things in the chat. And we'll give you a minute. Jessica?
I don't know if there's a question here about, because Barbara and I were focusing on the physician's well-being. How about employees, housekeeping, other departments?
Yes, so that is definitely part of my role. Not just the clinical staff, but very much, especially that values and practice program. We have a number of employees from housekeeping, from, like I mentioned, the grounds department, our volunteer services ballet team. So that's been something that reaches out across the campus.
We also talked about making this available. We'll make sure that you have something. We'll check out all the copyright issues and make sure that we get you something that can be useful for you.
I think, sorry, this is Casey. Kathy, I think that Janet wanted to know if you use this scale for that scale specifically for people outside of the physician groups.
Oh, I'm sorry. I may have misunderstood the question. So yes, I have actually used that in other departments. They just made it available to me not too long ago. Prior to that, we had something that was kind of similar that we had found in the literature when we were doing one of our research projects. They had like little thermometers for several of those scales, but it didn't include all 8 of those. So that's been something that we've started to use now. And Barbara or Jessica, do you guys have anything to talk to about ways of gathering creatively besides in Zoom? We have not had gatherings. I have been going to people, so I've been doing rounds in the COVID units and other units in the hospital just to make sure that I have a physical presence there and stay in touch with our employees.
We've actually had several through our GME office for our residents, and some of those have been, and one our pediatrics department had a wonderful online meeting. And this was actually called, it was like based on Rachel Remen's Finding Meaning in Medicine approach. So for those of you who are acquainted with Rachel Remen's work, you can certainly go online and find Finding Meaning in Medicine and find out how that's formatted. What we did is brought all these residents together, and the first question was, talk a little bit about when you think about being strong, who do you think of? And then we were immediately put into breakout rooms. And so we talked about our moms, our clergy, our, the mentors that we had. And then from there, the next question was, what do you feel like you need at a time like this? This was all at the beginning of COVID. And so when this happened, then I think we had probably 50 or 60 residents that were on and attendings. And so we did that. Then we came back together, and then the facilitator talked a little bit historically about Abraham Lincoln, what happened with him during very difficult times. And it was kind of a nice piece to end on. And people really loved that. Jessica, do you want to add anything to that?
Sure. Yeah, in terms of people getting together to encourage well-being, especially because of COVID, a lot of the residency programs are doing things amongst themselves. And so, like, I follow several of the groups on social media because they're all still working and seeing each other. They have really great chief wellness residents who are initiating all kinds of things. They still have beach outings, ice cream socials. They still retreat together, like our NICU fellows. Every year at this time of year, they go down to the beach side in San Diego and gather and connect. And so we see all the individual residencies doing a lot to support their well-being. So yeah, it's harder for our office to specifically interface with all the residencies. Most of our work these days is virtual. But yeah, no, that is such a great question. Kathy, there's a question about the chaplaincy department and yours, yeah.
I'm going to talk about the physical spaces real briefly. So currently we do not have what I wish. 10 years ago, the administration voted that we could have a center for renewal. Unfortunately, our space has been so crammed, we have never found a place for that. So as we move into our new hospital, there is going to be, we have outside of the chapel, they've created a beautiful garden area for people, for both employees and patient families. We also are creating a room for employees that will be available just kind of as a quiet meditation area. And then with the old hospital, which is no longer going to be able to be used for inpatient care, we are hoping that a very large area of that will be turned into a center for renewal that will include some treadmills and physical health spaces, as well as a prayer room and places for massage chairs and things like that.
We do, for our residents, I think we do have 3 chapels in our institution: a children's hospital chapel, an adult chapel, and then we have a residence prayer room, which, since we're a Christian institution, we wanted to make sure there was a place for our Muslim physicians to pray that wouldn't be full of iconography. And so it's a very lovely space where they can go in, meditate, or pray, have their prayers. And so we try to make sure that that's available. There's a question about it, how do we educate private practices about the importance of well-being and the connection to their business? That's the million-dollar question. I think physicians in private practice are really doing this balance between trying to make the bottom line work for their practice and to maintain their clientele, their patient population. And it's really very tough, but I do think that by word of mouth, I think, and especially with AMA and ACGME now, all of the initiatives around well-being, I think that, there's the triple aim of AMA, and we have to continually put that forward in meetings that are, discipline specific, but also specialty specific.
And if I can just quickly add before Kathy answers the question, there's a lot of literature out there on workplace wellness and how that's connected to financial issues. So if a business owner cares about economics and how well the private practice is doing, it serves them well to consider workplace well-being and how the staff are doing, how the physicians are feeling about themselves, their relationships to each other and to the patients.
There's a question about chaplaincy. Did we answer that question?
I just answered it, yeah.
Got it. I heard you, Kathy, but I wanted to make sure we had scratched where it
missed
itched.
it earlier, sorry about that. But yeah, we work together closely, but we are separate departments.
Typically, let me add one thing. Typically when it's not a pandemic, Jessica and I would be up in the hospital going through the sleeping rooms for residents, going to the lounge, being visible. About every week I would bake my signature persimmon chocolate chip cookies. Let me just tell you, they're the best in the world. And I put them in the anesthesia workroom, the break room. And you know, it's so amazing how a little thing like that will just boost morale. And I'd put something vegan in there, or I'd put something special, or a platter of fruit or something. And those things I think really boost morale. Because since COVID, I've gotten a couple of emails, hey, really missing your cookies, wink, wink. So, we try to make sure people know that we have their back and that they're not alone and that there's someone looking out for them, because you can do much better work when you know you're cared for.
Well, thank you all. It's been a pleasure to be with you.
Yeah. Thank you so much, Jessica, Barbara, and Kathy. This was such a great session. We really appreciate your time today and for sharing your experience with us. We'd also like to thank our national business members. We're so grateful for your support. And thank you so much to our audience for attending. Please keep an eye out for a recap of this week's sessions and an email containing a link to claim your continuing education credits for this session. We look forward to having you back on Thursday this week for Compassionate Healthcare Leadership in an Era of COVID-19, a panel moderated by Lorraine Ryan, Senior Vice President of Legal, Regulatory, and Professional Affairs for Greater New York Hospital Association. Panelists will include Tosin Boyo, COO of San Francisco General Hospital, Angela Patterson, Chief Nurse Practitioner Officer at CVS Minute Clinics, Roseanne Rasso, VP and CNO at New York Presbyterian Hospital and Weill Cornell Medical Center, and Penny Wheeler, President and CEO of Allina Health. Wishing you all a good week ahead, and thank you again.